2011, Science Media Kenya Limited was formed, and in 2015, we officially applied to the Communications Authority of Kenya to run a television station broadcasting in sign language. Operating on a social enterprise model, our objectives are to propagate social, economic, political, and talent development of persons with disabilities. Uniquely, Science TV has enabled many persons with disabilities to harness their talents by supporting their creativity and, by extension, reducing discrimination, social stigma, and boosting their self-esteem. 60% of our employees are persons with disabilities. With this talent pool, we have emerged as winners in several international and national awards. We were the first runners-up in the Communications Authority of Kenya 2018-2019 Kuza Awards, 2018 SDG Ambassadors, an award by the UNDP, British Council and ActionAid, 2019 Disability Inclusion Corporate Champion in the DIRA Awards, and we also are among the top 50 ranked solutions by the Youth Sustainable Development Solutions Network, and we featured in the Youth Solutions Report 2019, which was unveiled at the 74th UN General Assembly. And in 2020, we were awarded at the Zero Conference 2020 as the best tool to support communications in Vienna, Austria. In 2020, the world was hit by the pandemic and many people were affected, among them persons with hearing impairment, as the usage of face masks and isolation measures made communication an impossibility. With experience in the field, we launched Assist All, a sign language interpretation mobile application to provide communication between the hearing impaired .
Sunday morning, definitely. You never see us on air this particular day, but it is because it is a special day, and that is why we are here. It is the International International Day of Persons with a Disability, and the world over is celebrating. And this year's theme is gravitating around the achievement of the 17 Sustainable Development Goals. But the theme, particularly, this is the achievement of these sustainable goals for and by persons with disabilities, and it can't be even any better to have this conversation with people who understand the importance of such conversations and such celebrations. And joining me in studio this morning is none other than these are experts in their own field and in their own accord, and joining me is Mr. Kabanya as well as Madam Njeri, and in a little while they're going to be introducing themselves, and we're going to be talking about disability mainstreaming. And yesterday the Nairobi County also hosted their days of celebrations, because today is a Sunday. They decided to do it yesterday. They're going to be telling us how did it go down and which are some of the things that they are looking forward to, even as persons with disabilities strive to achieve the sustainable development goals. I am your host, Alan Hubbard, and the sign language interpreter is Tobias Omondi. You can engage with us on our social media platforms at Science TV Kenya, at the Alan Hubbard, hashtag inclusion works, hashtag International Disability Awareness Day. But also you can find us on SMS or WhatsApp. The numbers are scrolling on your screen, and we'll be glad to sample some of your feedback. Now, I am going to break the norms, and I'm not going to start with a lady, and I'm going to start with a gentleman. Mr. Kabanya, this is not your first time here. Kindly introduce yourself and tell us how you've been, probably.
Good morning, viewers. My name is Kabanya Lincoln. I work for Nairobi City County, where I head a division called Rehabilitative and Disability Services. I've been fine. As you rightly said, we marked the day yesterday.
Yes.
So we're gonna talk about it. Thank you.
All right. I'm now on to my immediate left.
Morning, viewers. I'm Catherine Wangechi Mwangi, working under the Nairobi City County, stationed at Bahati Vocational Center.
Yes.
And we are here to advocate for the best for the disabilities. Yeah.
Thank you, Madam Mwangi there, and apologies, I got your name as Njeri initially, but it's Madam Mwangi. Thank you for that correction. Before we go deep into this conversation, and even before you share what the Nairobi City Council was able to do yesterday, this theme for this year, achieving the sustainable development goals for and by persons with disabilities. What does it mean for the both of you?
For me, it means inclusion. Because for a long time we have made plans both in government and out of government. For a long time we have implemented projects and programs. Sometimes we sit down and make programs for persons with disabilities, but now we are saying that we have to be actively involved as persons with disabilities. That's why we are talking about with, for and by persons with disabilities. So they must be included both in our planning, looking at the SDG goals, where and how do they affect them, either positively or negatively. So when you look at those 17 sustainable development goals, then as a matter of fact, all of them touch on the person with disability, either positively or negatively. So that's why the theme is quite important.
Yeah. And Madam Mondi, yourself?
We are humble.
Yes.
And we are thankful for the day.
Yes.
And also to recognize the city county government. It's just a matter of advocating and looking for better ways to sustain the disability, to mainstream, and to look for better ways. And also to give awareness on people living with disability, or rather people with disabilities.
You all are mainstreaming experts. And before we talk about the day still yet again, how does mainstreaming look for you, even at the county, at the Nairobi County level?
I think for us, I would say every long journey begins with one step. Many times we have said we have not done enough, that we must accept, but we must also accept that we have made some strides. Because looking at where we were some years back and where we are now, we have been able to mainstream disability in most of the very critical and key areas, especially, let me talk for the health sector, because that is where I work. But also as a county, there is huge recognition that disability must be given priority. And that is why even His Excellency, the governor, when he constituted the government, we now have a sector called gender and inclusivity. That is where disability really falls, as opposed to other times when it was hidden under other sectors. So that brings out in fact, like yesterday, we had a huge support from that department, and we were thinking, how then do we mainstream disability within, especially the service provision areas in Nairobi County? Like as a sector, we have gone about to train, for example, healthcare providers on sign language. We have gone ahead and looked at how our facilities, we have actually mapped the facilities and looked at what do we need to do so that we become disability friendly in terms of accessibility, in terms of staff training, in terms of staff attitude. So we must say that we have gone far in ensuring that we mainstream disability within the planning of the sector and of the county. Disability is taken into a huge consideration and is given a lot of, gives a lot of input. When you look at our county integrated development plan, when you look at our annual development plans, there are many activities and many objectives geared towards issues disability. So we must say that somewhere we are not yet there. So we still need to do a lot.
Madam Mange, probably will flip the question for you and look particularly at sustainable development, sustainable goal number 8, which is more about achieving employment for persons with disabilities. You work with the county. Probably you could give us a first-hand experience. How has it been for you, and how do you envision it being for other persons with disabilities who stay in Nairobi?
Okay, right now, I think the county has done much. to do with the persons with disability. For one, I'm at the education department.
Yes.
And when we are admitting, we don't limit. There's that inclusivity. Whether one has any type of disability, we admit.
Yeah.
And we are doing in all our vocationals. At the background there,
Yes.
there are groups
Yeah.
which we try to interact with to see that we have helped also the society, trying to welcome every student or every learner who is ready to learn, whether deaf, whether what, all types of disability. So the county has played a big part.
Yes.
And also being one of the persons living with disability, I've seen a lot of recognition with the county.
Yes.
There before, there was nothing that was known that much.
Yeah.
But right now, I think the county is doing good. And also, the government as a whole, I think there is that big recognition. And I think we are trying to do the much we can to see that everybody has the right, every person with disability has the right to inclusivity in education, in employability, because we have groups there. There are these NGOs who are coming in, going around in our institutions,
Yes.
dealing on employability, career guidance,
Yeah.
how to handle cases on disability, such things.
Yeah.
Yeah, so we are doing good, but we are trying much so that we can go beyond. Yeah, because it seems as if it's just the beginning.
Yes.
Because there was not that much recognition, but now I think we are going somewhere.
There is light at the end of the
Yeah,
tunnel.
there is right.
But also they would say, why would definitely there must be light at the end of the tunnel? Why don't we push this light a little bit into the tunnel? And this segues me into my next question. The previous week I was in Machakos, and we were having a conversation around inclusive education, and Mr. Kabanya probably could also come into this. And what it came out very vividly was there is one, getting the students into the same learning institution, and then there is also the aspect of making sure that every child gets the quality education. Then how? Because yes, one, it is very important that we get the child into the school institution. That is very commendable. But then what are some of the steps that the county government, or from your point of institution, you are making to make sure that, yes, I am a deaf student, I will get quality education. I am on the psychosocial spectrum, I will get quality education. How are you all doing this balancing out?
What you are doing, okay, like the hearing impairment.
Yes.
Okay, I've been pushing, or we've been pushing as a group. There is a group that we are working with.
Yes.
To see that the county has employed the interpreters, because at times there are some language barriers.
Yes.
But still, on the same, we have students who are trained on that. So we try to work always and see that maybe the hearing impairment person is getting something. And in fact, we have seen doing the exams and then they pass.
Yeah.
But we are pushing still to the county that they take some of our teachers for the sign language sessions, or they bring the sign language, because that is where the problem is.
Yeah.
Because like the others, at least we handle them. We try to handle them well, and they are doing good. Yeah. But there is still part for the county to play.
Yes.
Because we need a lot of sessions, a lot of workshops. You see, it is just like a new thing that has just come in.
Yeah.
But we are trying our best. They are doing good. Like in a place where I am, I think we have 5. And they are doing good.
Yeah.
Yeah. But we are trying to go deeper into the society.
Yeah.
Because we are working with the NGOs. Maybe on girl child, the boy child,
Yeah.
and they are preaching the gospel that the children should not stay at home,
Yeah.
they should come. Then any problem that can be solved later, we are pushing on that. Yeah.
Mr. Kabanya, I understand your forte is not education, but probably you might have a thing or two to say about this.
Yeah, I think most importantly is that these people with disabilities and children, as you rightly said,
Yeah.
are enrolled in schools. But we must also look at what is the retention strategy in schools, because again, there are a number of, sometimes when we may take the children to school, but looking at what aspects then retain them in schools,
Yeah.
And so one of the things that has been practical is making the environment friendly, because that is one of the things that could make them drop out of school. Number two, we have a number of bursaries.
Yeah.
Because again, financial access could be a problem. We have a number of bursaries, and I also sometimes happen to see it even when you are allocating bursaries in Nairobi for the National Council for Persons with Disabilities. And most applicants, we look at many aspects, and I think, of course, that bursary is open to persons with disabilities, and that should go a long way in making sure that they are retained in school. Number three, the parents or the caregivers. We need to build the capacity of the caregivers to ensure that when the child or this person with disabilities enter into the learning system, then the parent becomes a pillar to ensure that this child or this adult remains in school. So there are many aspects we need to look at. I know the bursaries are there. I know MCAs and MPs and the National Council and the county itself is actually giving those bursaries to persons with disabilities in order to retain them in school. I am aware that even the government allocates specific amounts of money in schools over and above what they allocate to each child in the regular schools. So these are all aspects of ensuring retention of children with disabilities in schools.
Yeah. Let's talk celebrations, and now I am moving into the celebrations yesterday. Probably I would start with Madam Mwangi here. What are some of the activities that were done, and what was the core message that as a county you're pushing out to the masses?
One is in fact it all starts with the sharing experience. Just to a person like I.
Yeah.
You share the experience. Then you try to advocate. To advocate for in case of any health, any education, you advocate for all.
Yeah, inclusion.
Yeah,
Basically.
inclusion.
Yeah.
The awareness to the society, to the community. You see, at times you see those people with disabilities. At times they stay at home.
Yeah.
Maybe they are being used in a bad way. Some are, you see, those kind of things. So we are trying to give a message to the society, to the community down there. We always have meetings, but we try to talk to the society, the community, that person is not limited to anything. He or she has the right to go beyond boundaries, because we are disabled differently, but we are able differently. So we are trying to give that message, the awareness to the community, to see that this narrative has changed. It has to change to a better narrative for those people. So we are trying our best, what we can do. We are advocating on good things, or the better life of these people. Being a child, being a grown-up, being a teen, we are advocating to all. Yeah.
Mr. Kabanya, probably you could also tell us where the event was happening and what particularly stood out for you.
The event happened, we started with a procession from Mathare North Health Center. Mathare North is in the area of Mathare 4A, and we had a beautiful procession from there all the way up to Thika Road to National Youth Service Headquarters grounds. So that is where we had the celebrations, and for me what stood out is the positive message. Because we had people with disabilities coming to share their talents, coming to talk about positive stories, rather than many times we tend to complain, but rather than that we wanted to bring out a positive image. We had for example DJ, we were on the decks, and she could motivate people that she can be able to do that with her feet. We had children with disabilities bring out poems and speeches. So what stood out for me is the positive aspect of life, and telling the person with disability out there that there is so much they can do, and also impacting on the communities. Because the fact that community comes together, or you do that procession and you distribute posters, and people get interested to know about issues of disability and see that there is always something they can do. We had many partners celebrating with us or joining us, either to support or just to attend. We had persons with disabilities attending. We had government officials. So even the few complaints that we have an opportunity for the government to listen. So it becomes almost a part of public participation, where the government also listens to what gaps we have, what challenges are we having, and therefore even as we go back to do the planning, we already have the voice of the person with disability with us. So for me, mostly what stood out, the positive aspect, the many things and opportunities that the person with disabilities have, the talents that they have which they can exploit. So that positivity was what stood out to me.
I don't know if Madam Wong, you have something to add before we go for the break.
What I would say,
yes,
I think there is a lot to be done. The government has a role. The county and the national government, it has a role, and a big role. Because you see, like when we talk, for example, the place I am, you see there are some things that needs to be done. Just like the areas, some of the areas, because you see some of the persons with disability, to assess something, maybe the washrooms, they start a bit of straining. Maybe the equipment, they start thing. But there is a lot to be done. Yeah.
Probably when we come back, you'll be able to share some of the other things that need to be done, but also not being adamant that there is still a bit that is being done by both the county government and the national level. So if you are watching, allow us go for a breather. But when we come back, we're coming back with Madam Wangi and Mr. Kabanya, and we're continuing with this conversation of disability mainstreaming. Remember, today is the 3rd of December, and we are celebrating the International Awareness Day of Persons with Disabilities. We'll be back shortly.
In 2011, Science Media Kenya Limited was formed, and in 2015, we officially applied to the Communications Authority of Kenya to run a television station broadcasting in sign language. Operating on a social enterprise model, our objectives are to propagate social, economic, political, and talent development of persons with disabilities. Uniquely, Science TV has enabled many persons with disabilities to harness their talents by supporting their creativity and, by extension, reducing discrimination, social stigma, and boosting their self-esteem. 60% of our employees are persons with disabilities. With this talent pool, we have emerged as winners in several international and national awards. We were the first runners-up in the Communications Authority of Kenya 2018-2019 Kuza Awards. 2018 SDG Ambassadors, an award by the UNDP, British Council and ActionAid. 2019 Disability Inclusion Corporate Champion in the DIRA Awards, and we also are among the top 50 ranked solutions by the Youth Sustainable Development Solutions Network, and we featured in the Youth Solutions Report 2019, which was unveiled at the 74th UN General Assembly. And in 2020, we were awarded at the Zero Conference 2020 as the best tool to support communications in Vienna, Austria. In 2020, the world was hit by the pandemic, and many people were affected, among them persons with hearing impairment, as the usage of face masks and isolation measures made communication an impossibility. With experience in the field, we launched AssistAll, a sign language interpretation mobile application to provide communication between the hearing impaired and different service providers. Post-COVID-19, the application shall be used in higher education, employment, judicial systems, and social settings. Find the application on the Google Play Store. Are you implementing, working, or championing for inclusion? Partner with us to ensure inclusivity in every communication or project undertaken by you. Get in touch with us. The website is www.sciencemediake.com. The email is info@sciencemediake.com. Telephone 0111 980384, or you can find us on Twitter @ScienceTV Kenya. Welcome to the home of inclusion, and let's make communication beautiful.
AssistAll is now available on the Safaricom M-Pesa app. To use AssistAll, simply log in to my M-Pesa app, go to Services, select AssistAll, follow the prompts, and your account is ready to use. To get an interpreter's services, simply click on the interpreter's icon and select an available interpreters from the list provided. AssistAll, sign language interpretation at your fingertips.
We are now closer to you. In our quest to reach you, we are in Mount Kenya region, Coast region, Western region, Nyanza region, Nairobi region, Eastern region, and Southern region on free-to-air platforms, Signet, GoTV, and StarTimes. And to make things even better, you can now watch us online on www.sciencetv.co.ke/live on any internet device, your phone, tablet, laptop, and desktop computer from anywhere in the world at any time. Science TV, leaving no one behind.
Back from that break, and we are glad you're still watching Science TV with me, Alan Hamilton. My guests in studio this morning are Catherine Mwangi and Mr. Lincoln Kabanya. They are all or both from the Nairobi County, and we are talking about matters disability mainstreaming. Remember, today is the 3rd of December, and every other 3rd December, the world over celebrates the International Disability Awareness Day, or the International Day for Persons with Disabilities. Yesterday, Nairobi hosted their celebrations, and in our first segment, we have talked and spoken extensively about this. But now we want to move into where the county, or where the gentleman and the lady who are seated this morning here get the ability or the mandate to do and implement this work. And I would probably start with you, Mr. Lincoln. There is a disability mainstreaming committee at the Nairobi County. Could you tell us a little bit about it and its composition?
Thank you, Herbert. The disability mainstreaming subcommittee. Let me start with at the national level.
Yes.
We have what we call the intergovernmental consultation framework on gender issues.
Yes.
And when that was set up, there were a number of other structures below the national that were supposed to look at how do county and national governments continuously consult and cooperate on matters of gender.
Yes.
And at the county level, we have what we call the county gender and intergovernmental county gender working group in each county.
Yes.
Now below that, counties had specific sectoral thematic areas.
Yes.
Where we have issues like GBV, issues of women in business. We have about 4 subsectors, let me call them subsectors. And within Nairobi, we felt they were supposed to mainstream disability in those sectors.
Yeah.
But when we sat down, we thought many times matters disability are lost within other sectors when we still continue saying let's specifically mainstream them there. So as Nairobi County, we said we must have a sectoral working group called the County Disability Mainstreaming Sectoral Working Group. So which now reports to the Intergovernmental County Gender Working Group. So we specifically look at issues disability. So this sector working group, or Disability Mainstreaming Sector Working Group, has composition of government departments that directly relate to issues disability. So the National Council is also a part of the sector working group. Then we have brought in partners that are working in Nairobi in the area of disability. Why we do that is because number one, we used to have a lot of duplication.
Yes.
And sometimes I want to call it confusion in terms of how do even partners work together in the community. But remember, you are targeting the same community. So if I was to walk to, I'll give an example of Mukuru, where you would find like 5 or so partners are working there, but they don't even know each other. They don't know who does what. So this forum, we brought in partners together and the government departments together. I am in health. There's somebody who is in gender and inclusivity, where there is a disability department. So we group the National Council. So we come and say, I have a role, you have a role, National Council has a role, each partner has a role, so you do not lose your identity and you don't lose what you do as a partner, but you end up complementing each other and synergizing all the resources and planning together. So sometimes we would come and say, let's plan together, let's do an annual work plan together and look at what are the common activities that we can join hands and to do together. And one of the examples was yesterday, where we all, instead of having one partner working doing a small activity at Langata, another one at Roysambu, another, so we say, why don't we make a difference by harnessing all these resources together and efforts together and really coming up with a huge celebration like what we did yesterday. We have done it for even other international and national days related to disabilities. We have also been able to get partners come and support other activities. For example, moving out to even do the disability assessment and medical assessment for personal disabilities for registering with the National Council. So partners have known that we as a government cannot do everything. We need each other so that we can move on. So this is just a framework of working together and creating uniformity, harnessing resources and efforts in order that we reap the maximum benefits from resources both from the government and the partners in order to benefit that person with disability.
Madam Catherine,
Yes.
to continue with that thought of Mr. Kabanya, then where you as a person with a disability, where do you tap into that committee, and what is your role then?
Thank you. What I would say, the work we are doing, or what we are doing, or what we are working for the county government, is a joint work.
Yes.
It's teamwork. As Mr. Kabanya has said, you cannot make it alone. We need to have teamwork. So that is why we have the good wishers or the groups to help us in some areas.
Yeah.
Like now there is the counseling being held by the in-job. There are others for the girl child, there are others for the boy child. So we are working as a team. But by the end of the day, the county has to get reports on what we are doing. And we are trying the much we can so that we can reach everyone. Everyone. The person with disability, and also we preach to others, because disability, no one knows about tomorrow. No one knows about tomorrow. So we also prepare them. We also give them message how to do to that person or how to handle. Because when you see to people living with disabilities, at times there is that lack of knowledge. They don't know where. So they are just there. The people who are the caregivers, maybe some of them they don't know where to start. So that is why we are advocating on this, and we are doing it as a teamwork, so that when you do the other side, the other one is on the other side. By the end of the day, this will come to one point, so that we can help the society.
And maybe if I want to just add a little bit on what she's saying and what I said, is that within the committee or within that sector working group, we don't just have NGOs. We have CBOs,
Yes.
and we have DPOs, disabled persons organizations, and therefore we have quite a number of people with disabilities who also sit in that committee. So you don't just limit to partners, and partners, we encourage them that the membership to that committee, if you have the ones that have either PWDs working with them, they should be in the committee. So we have quite a number. We have founders of organizations for persons with disabilities, because either I'm a parent or a caregiver.
And then that stays true to the celebration of this year's Disability Day theme. But then, as this work is done, you must, as Madam Catherine here said, that you must write reports back. Which are some of the success stories that you've seen and that you have achieved thus far with the mainstreaming committee? And also, you roughly touched base on how non-state actors and state actors coming together. But how has the collaboration been, and which are some of the success stories that the committee has seen already?
I think one of the things that I want to emphasize is that in many cases in the past, people used to be non-state actors especially used to be like, should I say, competition instead of complementing each other.
Yeah.
So you would find this partner doesn't want to know what this other partner is doing, and they would feel harassed if they found another partner there. So there was a lot of conflict. So one of the things we have brought together is sanity in the way we do things, in the way we deliver services to persons with disabilities on the ground. Because right now, partners have known each other. We have, for example, partners who work in a place like Roraka. Let me give an example of Roraka.
Yeah.
So you could find partners that did not know each other now know each other, and the service delivery has improved, because I could be doing. There are all those aspects in terms of disability. There is health, there is education, socioeconomic empowerment, there is advocacy. So all those aspects, instead of one person doing one thing, people have come together and said, I am doing health, you are doing socioeconomic empowerment, I'm doing education. And so if I support education, and the child possibly does class 8 or form 4 and needs to transit to maybe a vocational training or whatever training, then you push that to socioeconomic empowerment. There is somebody who is doing health. Now when I do health, these people need to transit to the schooling system. So I'm able to transit this person, and so it becomes an all-rounder in terms of service delivery. Number two, we have been able to, for example, reduce the wastage, because one partner could be doing, two partners could be doing the same thing in the same sub-county or in the same, for example, informal settlement. So what we do is, now partners recognize that the government must be on the lead. So they come to us and tell us, we have this project that we want to implement, and we are thinking of implement it in Kibera, for example. Then we discuss and say, we have a partner in Kibera doing that. Why would we shift your project to Kawangware? So that makes resource utilization more accountable. Yeah. We save on resources. There is no duplication of services. There is no confusion for that person with disabilities. And then, most importantly, planning together. So we plan together. We come up with plans, and when a partner comes, they can just plug into our annual plan, because we all as a group agree that these are our priorities. These are priority objectives. These are priority activities. So any other new partner coming in, they just plug in and say, I will plug in this area. So those are some of the success stories I think we've had. The partners have also been able to stand with the government, yes, and assist the government achieve sometimes what we may not be able to achieve, because I have seen a partner come and say, we have a problem. I told you we did mapping and accessibility audits to some of our facilities. So we find, for example, if you go to a maternity, we want to give an example of maternity, you find there may not be beds that are adjustable. You see, delivery coach is something that is very high. So you might find a person with disability may not be able to, we may have to lift that person to the couch for them to deliver. Now a partner would come and say, I will buy 2 delivery coaches for this facility. A partner would come and say, yes, we have a lot of stairs in this place. Can we do more reasonable modification by assisting the government to do the ramps in the facility? So as we do our part as a government, the partners also have a responsibility to play, and we have seen facilities transforming and becoming friendly to persons with disabilities. Others have come in and said, since we have already identified the gaps and we cannot be able to sort out all the issues, others have come and said, we want to train for you 10 healthcare providers on sign language. Yes. So we are saying that we have seen that continuous cooperation and collaboration between the government and the partners, and without feeling like we are losing identity, either as partners or as government, and without the government also seeing like someone else is taking their responsibility, but rather seeing ourselves as a team that needs to work together.
That is quite a mouthful, and Madam Catherine, if you have something to say, probably could chime in. But Mr. Kabanya, that is a mouthful, and definitely achieving such tremendous work, then it would come with its own obstacles. Probably would you mind to share which are some of the obstacles that you are finding along the journey, and which are some of the things that you and the committee is planning to be able to avert some of these challenges?
I think the most important, the biggest challenge that we get is also huge expectation.
It's the government, so you are supposed to be able to do this.
As the government, we are supposed to do everything.
Yeah.
Now, when you bring in the partners, sometimes also the person with disabilities would expect that we have come up with the solution to all their problems. Yet, the needs and aspirations of persons with disabilities are quite enormous. So we can only be able to meet a few. So one of the challenges that we face is high expectation, especially on the person with disabilities, which sometimes you're not able to meet. And one of the things that we do to mitigate on that is to make them understand that we are here purposely to look at objective ABC.
Yeah.
So if we have, for example, come to do assessment for persons with disabilities for registration in the National Council, that is our agenda for that day. If we have a partner willing, for example, to support on what we call mobility appliances, we make them understand that we as a government and the partner are able to give the mobility appliance, but there could be other socio-economic issues that the person with disability has. So we are saying that the biggest challenge is the needs are many, the resources are few. of course, one way of mitigating also is to continuously look for partnerships and continuously identify those gaps so that we can tell the partners, even when they are doing their programming, they can be able to capture what are the needs, the specific needs, because we must be sensitive to the needs. We must be client-centered because our client is that person with disability. So we endeavor to ensure that we tailor partners and ask partners, please, these are our needs. So even if you program, please look at these areas. The other challenge I think that we face is, of course, the shortages. There are huge shortages in terms of staffing in most of the government departments. Of course, this is just to say that the population has increased, the resources are few, so we must work within those limits. So we have infrastructural problems in service delivery areas. We have multiple clients coming to seek services which sometimes we may not be able to give. So, but other than that, I think we continue, continuously fight, because at the end of the day, what we want to see is if we aimed at 50% and got 40%, we are somewhere. If we improved from 50% to 60%, we are somewhere. So we are looking at that person with disability, what is the best for them? Yes.
And that is a very integral question as you winded that particular answer. That person with a disability, what is most important for them? This is where I would, Madam Catherine, do you have anything to add on what Mr. Kabanya has said? Probably you have a thing or two to add.
Thank you. He has already said about maybe the beds they have or the maternity or other areas. So that one is part of healthy services.
Yes.
And also maybe when one needs a service, there is that maybe the distance from where the person with disability is coming from to where
the services
he or she is getting the services.
Yeah.
So when you get there, maybe accommodation, the services, or rather what do I say? Or rather whatever is there, it's not favorable for the person.
Yeah.
For example, maybe like I don't sit on a lower seat because the problem is my back.
Yeah.
So you need a seat.
Yeah,
so it is a bit hard to fulfill everything, but I think as we move on, things are going to be done. So one is the healthy services.
Yeah.
The other one is the information. Getting information, that person getting information down there. One, for example, there's this somebody with hearing impairment. Okay, we move on advertising something or advocating something, but that person is just there. So, or rather, he's just there or she's just there, or that child is just there, but not aware of what is going on. The communication. There is the communication barrier, and also the reaching the information to that person. So I think the government needs to go beyond, and all of us, because we are given that mantle. So there is that information not reaching well to that person down there. There is also that is our struggle in getting information. There's also the support services. You see, some problems deteriorate just because they were not recognized earlier. One, the person down there or the caregiver did not know the whereabouts, like the machines for whatever, the gadgets, those things. There is somebody who is in Nairobi but doesn't know where he or she can get a wheelchair. So those things, even when in primary schools, we also touch those grounds. You see, the child is there, but the services do not accommodate. It's not accommodating. So there is a lot to be done. So there are services, the reaching of information, and also the accommodating facilities. Yeah.
If you allow me,
yes,
just to say something. So we as the mainstreaming committee or the subsector working group, we also aiming to influence policy. Because sometimes you see, as partners and the government and people on the ground like us, we are the people who know where there are gaps in policies. So right now, as we talk, you remember there is a bill in Parliament, the PWD Bill 2023. So as a committee, as a sector working group, we have sat together and developed a memorandum towards support of that bill. What do we want to see in the bill? And we have even gone ahead and met with some parliamentarians, KDPA, Kenya Disabled Parliamentarians Association, just to influence. And we are looking forward also to very soon meeting the Parliamentary Committee on Social Protection, so that we can take them through that memorandum. And we can also advocate and say, where do we need to go? Where do we need this bill? And influence them to support the bill, so that, remember, it was undertaken by the previous in the previous Parliament. So we also look forward to actually influencing policy, because policy, we plug on policies and they will allow us to do a lot of other activities towards persons with disabilities without necessarily coming into conflict with the law. And when you embed something on policy, then we are saying, for example, what are the rights of persons with disabilities, what are the aspirations, what do they need to do? So we are looking forward to influencing policy. Even Nairobi itself, we have the Nairobi County Person with Disability Bill. As a committee, we were also involved in mobilizing our persons with disabilities and partners to come, especially even during the public participation. We also gave our input and actually mobilize them to come for public participation, so that what comes out in the Nairobi County Persons with Disability Bill is reflective of what that person with disability on the ground wants.
And you sort of snatched a question from me, because I was like, don't you think it would be more easier starting home than starting at the national level? But though I would understand that Nairobi is a cosmopolitan sort of county, you can't deal with Nairobi alone, and you're not dealing with the national government. So I want us to take a short break, and when we come back, you're sort of going to tell us what exactly is in this Nairobi Persons with Disabilities Bill, because this is a bill that was initially initiated in 2016, 2015, if I'm not wrong. And it has taken quite some time, and actually there are even some persons with disabilities who stage demonstrations, and there are also some WhatsApp groups where I am at, where people are still trying to come up with demonstrations to sort of seek attention from the county government of Nairobi. All of that you're going to be telling us when we come back from this break, and also probably the work that the county is doing in terms of accessing health, in terms of HIV and AIDS, because we also saw that on 1st December we celebrated International or World AIDS Day. We're going to be talking about that extensively. Dear viewer, we are still with Catherine Mwangi and Lincoln Kabanya. We're going to be coming back with more when we come back from the break. Keep it tight.
In 2011, Science Media Kenya Limited was formed, and in 2015, we officially applied to the Communications Authority of Kenya to run a television station broadcasting in sign language. Operating on a social enterprise model, our objectives are to propagate social, economic, political, and talent development of persons with disabilities. Uniquely, Science TV has enabled many persons with disabilities to harness their talents by supporting their creativity and, by extension, reducing discrimination, social stigma, and boosting their self-esteem. 60% of our employees are persons with disabilities. With this talent pool, we have emerged as winners in several international and national awards. We were the first runners-up in the Communications Authority of Kenya 2018-2019 Kuza Awards. 2018 SDG Ambassadors, an award by the UNDP, British Council and ActionAid. 2019 Disability Inclusion Corporate Champion in the DIRA Awards, and we also are among the top 50 ranked solutions by the Youth Sustainable Development Solutions Network, and we featured in the Youth Solutions Report 2019, which was unveiled at the 74th UN General Assembly. And in 2020, we were awarded at the Zero Conference 2020 as the best tool to support communications in Vienna, Austria. In 2020, the world was hit by the pandemic and many people were affected, among them persons with hearing impairment, as the usage of face masks and isolation measures made communication an impossibility. With experience in the field, we launched Assist All, a sign language interpretation mobile application to provide communication between the hearing impaired and different service providers. Post-COVID-19, the application shall be used in higher education, employment, judicial systems, and social settings. Find the application on the Google Play Store. Are you implementing, working, or championing for inclusion? Partner with us to ensure inclusivity in every communication or project undertaken by you. Get in touch with us. The website is www.sciencemediake.com. The email is info@sciencemediake.com. Telephone 0111 980384, or you can find us on Twitter at Science TV Kenya. Welcome to the home of inclusion, and let's make communication beautiful.
We are now closer to you. In our quest to reach you, we are in Mount Kenya region, Coast region, Western region, Nyanza region, Nairobi region, Eastern region, and Southern region on free-to-air platforms, Signet, GoTV, and StarTimes. And to make things even better, you can now watch us online on www.sciencetv.co.ke/live on any internet device, your phone, tablet, laptop, and desktop computer from anywhere in the world at any time. Science TV, leaving no one behind.
In 2011, Science Media Kenya Limited was formed, and in 2015, we officially applied to the Communications Authority of Kenya to run a television station broadcasting in sign language. Operating on a social enterprise model, our objectives are to propagate social, economic, political, and talent development of persons with disabilities. Uniquely, Science TV has enabled many persons with disabilities to harness their talents by supporting their creativity and, by extension, reducing discrimination, social stigma, and boosting their self-esteem. 60% of our employees are persons with disabilities. With this talent pool, we have emerged as winners in several international and national awards. We were the first runners-up in the Communications Authority of Kenya 2018-2019 KUSA Awards. 2018 SDG Ambassadors, an award by the UNDP, British Council and ActionAid. 2019 Disability Inclusion Corporate Champion in the DIRA Awards, and we also are among the top 50 ranked solutions by the Youth Sustainable Development Solutions Network, and we featured in the Youth Solutions Report 2019, which was unveiled at the 74th UN General Assembly. And in 2020, we were awarded at the Zero Conference 2020 as the best tool to support communications in Vienna, Austria. In 2020, the world was hit by the pandemic and many people were affected, among them persons with hearing impairment, as the usage of face masks and isolation measures made communication an impossibility. With experience in the field, we launched Assist All, a sign language interpretation mobile application to provide communication between the hearing impaired and different service providers. Post-COVID-19, the application shall be used in higher education, employment, judicial systems, and social settings. Find the application on the Google Play Store. Are you implementing, working, or championing for inclusion? Partner with us to ensure inclusivity in every communication or project undertaken by you. Get in touch with us. The website is www.sciencemediake.com. The email is info@sciencemediake.com. Telephone 0111 980384, or you can find us on Twitter @ScienceTV Kenya. Welcome to the home of inclusion, and let's make communication beautiful.
My name is Luke Kizito Ojambo Muleka. I am the founder and managing director of Science Media Kenya Limited. Science Media has two products. One is a sign language television station, Science TV, and a sign language interpreter's mobile application, Assist All.
Welcome back from that break. We're glad you're still watching Science Breakfast with me, Alan Hubbard, and the sign language interpreter is Tobias Omondi. And this morning we're having a conversation about the International Day for Persons with Disabilities, and this year's theme is around achieving the Sustainable Development Goals for, by, and with persons with disabilities. Joining me for the conversation this morning is Madam Catherine here, who works with the county, the Nairobi County government, but as well as Mr. Lincoln Kabanya, who works with the county government in the sector of rehabilitation and particularly health-related issues. Now, this conversation is brought to you by No One Out, which is one of the stakeholders, I believe, Mr. Kabanya, who works in Nairobi County to make sure that that some aspects of disability inclusion are achieved in the county. Probably we could start it even from that point of view. Which are some of the stakeholders that you're working with, but also particularly which or what is the role that No One Out plays in this entire scope?
No, so we have membership from, I said, government departments first.
Yeah.
So all government departments that have a role to play in matters related to disability.
Yeah.
Then we have stakeholders or partners. I may not name all of them, it could be as many as 50.
Yes.
But specifically, like no one out come out very strongly when it comes to issues of advocacy. They're also doing a lot in the area of vocational training, supporting people with disabilities to go or to undergo skills training in the vocational training institutions. We have also worked in community-based rehabilitation programs where we take the service closer to the people in order to improve access. So we have partners working right from the health sector or department or the health component of the whole disability sector. We have partners who are doing education. We have some who are doing a lot of advocacy, socio-economic empowerment. We even have some who are supporting women with disabilities access things like small businesses. So it's a cross-cutting sector working group that has partners who are strong in all these areas. But specifically, no one out. We are working with them in the area of health, rehabilitation. We are working with them in the area of vocational training, where they have supported children. They are also supporting regular education for children with disabilities. The other partners cut across.
Okay, and I want us to focus on this aspect of health and probably what are some of the challenges that persons with disabilities face in the advent of or in relation to HIV and AIDS, and which are some of and how can the Disability Mainstreaming Committee support in advocating for access to health? Probably we could start with you, Madam Catherine, as Mr. Kabanya will be giving us that now. All like sort of bird's eye view perspective.
Thank you. As I would say again, there is about the healthcare. The healthcare, as in that person is there, and maybe in some of our hospitals or dispensaries, there are facilities that can handle the therapy, whatever, but lack of knowledge, lack of know-how. So, the advocating of awareness, and the places to take the issues. So one is the healthcare, the other one is travel in getting information, as I had said earlier. So these people, as you dig in or as you talk to some of them, the knowledge of knowing where, the communication, it has not reached down there. So there is that challenge. And again for the healthcare, maybe there is when people living with disability, maybe they go under maybe some difficulties, they are under threat, or maybe they are those SGBs. Some of them do not know where to go. And maybe some of our hospitals or dispensaries, even at the county, they give NHIF services testing for free. But you see somebody down there doesn't know. So there's need for awareness. The advocation of the awareness to the society, to the community, and also letting the community and the society to know that when there is a disability person in the family, it is not a curse. They should learn to take it positively, because we have seen many imagine and also defeating the odds. So they need to be educated on that. The other thing is the support services, which is also close to health services. They are almost close to one another. So the health services, you see, maybe I've gone to the dispensary, there's no interpreter, maybe the language, or maybe that handling. People should learn how to handle these people. They are delicate, as much as we say disability is not inability, but there are those weak areas. They get traumatized. There is those people who got traumatized immediately they got that disability. You know, disability, there is that that you are born with. There is that you get in life.
Yes.
Which just come in. So that traumatization, I think there is need for people to be educated, because you see that person is there being traumatized, having low esteem, extracting himself or herself from the group. You see, there are those people. So there is that message which needs to go down there.
Yeah.
For one to feel that he or she is capable, that child is capable of education and can go far. So we need that something background there.
Yeah.
We need to go to the ground because many people don't know.
Mr. Kabanya, then what would be your take, and also looking at that on Monday, on 1st December, I don't remember, was it
1st of December? Yes.
Yeah, 1st of December. Yeah, the CS for Health, Susan Nahumicha, came out and said that around 1.4 million Kenyans are affected by HIV and AIDS, and definitely this is a huge number, and persons with disabilities definitely are included in that. From a Nairobi perspective, what more can be done? Also honing into what Madam Catherine here is saying, that there might be some services that are being provided for free, but people might not know. From a Nairobi County perspective, and also from the Disability Mainstreaming Committee perspective, what can be done, and what are you currently doing?
I think one of the talking about HIV/AIDS, one of the challenges that we face even with our colleagues is they're not realizing that persons with disabilities also have their own needs in terms of sexual rights and reproductive rights.
Yeah.
And so sometimes I would want to look at persons with disabilities as also a population at risk of getting HIV, and that require much more efforts, because there are persons with disabilities who will ultimately understand, like the way me and you are talking.
Yeah.
But there are some of them that you may have to take extra efforts to make them understand. So like when you go to school, a child with disability will do as much as this other child, but they may require a little bit more time. So even as we are passing information on HIV/AIDS, number one, how is our format? How have we formatted it in order to ensure that the person with disability also gets that message? Number two, how are we taking care of this person with disability in terms of prevention of HIV and AIDS? Because at the end of the day, I said they could also be counted as a population at risk, because some of them do not have a lot of information. So we have collaborated very, very well with that unit of HIV/AIDS, and in fact some of our partners that support disability also support issues HIV/AIDS, because we don't want them to be left behind. So we want to ensure that it is mainstreamed in the area of HIV/AIDS. Our persons with disabilities also get information in a format that they can be able to understand, in a way that they can be able to understand. We have gone ahead and tried to train especially those counselors that are working in the testing areas, so that they can be able to counsel. You see, one person came to me, actually the clinician, who told me he got this gentleman that was deaf, and he did a HIV test. The person was unfortunately positive, and he was not able. Now he got stranded and was wondering, how do I even explain to this client that is HIV positive? So that opens up eyes and say, why don't we have all the people that are doing working in the HIV/AIDS clinics? Why don't we have at least 2-3 of them trained on sign language? Because that's the very, very key for especially persons with. Number two, we also have attitude problems. We must accept we have attitude problems, not in all, but in some of our own workers. So we also, there's a training we call disability etiquette, which we have put in most of the trainings, even in areas of HIV, nutrition. When they're going to train on other key aspects, we ask them, can we have a session to talk about disability etiquette? Because there are some things we do without necessarily knowing that we are offending that person with disability. So we train them how to handle a person with disability. So we are not coming to train you on your profession, but when you are delivering your service, how do you handle this person with disabilities? And that's what we have done in most of the areas where they're doing testing and counseling of clients, so that at the end of the day, we encourage these people to come out. Number 3, we have also been able to train community health volunteers. And these are, now we have changed them from community health volunteers, we are calling them community health promoters. So while we train them on those other key components of health, we have come in to train them on issues of disability, and so that they can continuously pass messages to them in relation to health, including HIV/AIDS, and also encourage them to also go for testing, because most of them actually keep off. In fact, my working experience shows me that most of the clients with disabilities go to facilities for especially emergency services, or you want to go for treatment because you are sick. Most of them don't go for health promotion services. Do I go there to do, for example, cancer screening? Can I go there to do a HIV test? Can I go to somebody and talk about nutrition, or to check my blood sugars, my blood pressure? You know, not necessarily that I'm sick, but I want to walk into the hospital. So we are because people live in the society. So we are using community health volunteers and the disabled persons organizations to ensure that they mobilize them, and so that they are able to access health services, including HIV, including sexual reproductive health services.
We've belabored, I would say, extensively, and I would like us to come to the end of this conversation. But as we come to the end of the conversation, I would like to pose a question. If we fast forward to December 3rd, 2024, which are some of the things that Madam Catherine or Mr. Kabanya would you like to see different happening at the county level? Probably one of them would be the passing of the Persons with Disabilities bill or act by that time, because we had mentioned that we'll talk about it. But what are some of the things that you are really keen that we should be celebrating come 3rd December 2024? Probably starting with you, Madam Catherine.
Thank you. One of the things is that the staff need education. They need to be taken for workshops, for such educations, as Mr. Kabanya said about the interpreter. There are so many things. And again, about the buildings, there needs to be some changes. The other one I can say is that if those persons with disability can be reached well, and then they organize for groups, they go for counseling, because there are those who have stayed for years but live in denial. There are those who live in denial, and they need education to know that they are not limited to any service. They are not limited to reach anywhere. So there's need for a lot of counseling. There's a lot of counseling, because you see there are people who live in denial. There's also those caregivers. They also abuse the disability people there, down there. They need also to be educated. They need to be reached to, because you see, as the minister said about the HIV and AIDS, some of them, they are being raped. They don't know where to go for emergency services. So you see that is why the number is getting big, and also unwanted pregnancies. For example, maybe somebody with hearing impairment, she cannot shout for help when in danger. She can't. So she gets into that problem. After that, she doesn't know where to go, where to rush. There are these pets, you call them pets or whatever, for prevention. They don't know.
Yeah.
So there's a lot of education needed to staff and also to the people here on the ground. Yeah. But I think we are going somewhere. So long as now it is totally recognized that there is somebody down there living with or with a disability. So I would like to say that there's much to be done.
Yeah.
There's much to be done.
Mr. Kabanya, what are we celebrating next year?
I think for me, one of the most important things that we can celebrate is passing of the two bills. The one in the National Assembly and the one in the County Assembly. Let me limit myself to the one in the County Assembly, because one of the key, allegedly, we passed one in 2015-2016. We never constituted a board. If we are able to pass this one and constitute a board, and it also provides for an establishment of a Nairobi County Persons with Disability Fund. Now that fund will assist in acquiring of assistive devices for persons with disabilities. It also provides for assistance in terms of school fees. It provides assistance for the cash transfer fund for children with severe disabilities and caregivers, so the children with severe disabilities. It also provides, remember the governor has promised to do 17 centers of excellence, rehabilitation centers of excellence. That means one in every sub-county. I would want to see that bill having passed, created a board, and at least ensure that by that time we have a few centers out of the 17 that have been completed. Because that is given in one of the provisions, I think it's section 22 if I'm not wrong, of the bill that is supposed to be passed by the County Assembly. So for me that would be a huge milestone for Nairobi County. I know there are some other counties that have passed, but Nairobi must lead. People must come and benchmark in Nairobi. So if we can be able to pass that, have the board constituted and have already the fund established, for me that would be a huge success, so that when we celebrate that day on 3rd of December, we have less of complaints and more of success stories. That's what I'm looking forward to. From persons with disabilities, we have less complaints and more of success stories, because we have been able to, at least we have been able to take them from point A to B.
All right. And I think these are our prayers that we have already put forth, and we hope that they will definitely come to pass. And thank you very much for making time on Chilly Sunday morning to come have this conversation. It has been Madam Catherine Mwangi and Mr. Lincoln Kabanya. They all are from the Nairobi County government, and they work at different levels. One in the health sector, the other in the education, particularly vocational training sector. And I've been your host, Alan Howard, and sign language interpreter has been Tobias Omondi. This conversation has been brought to you by No One Out, as rightly said by Mr. Kabanya. They work through different thematic areas, including education, vocational training, but as well as supporting persons with disabilities access health services. I would once again like to wish you who is watching a happy International Disability Awareness Day, and I hope that you've been able to stay true to the theme of this year, and you are doing whatever you can to achieve the 17 Sustainable Development Goals with, by, and for persons with disabilities. Let's see you actually tomorrow as I bring you the breakfast show. Have a nice Sunday.